Presenting a patient index, decision aids app for shared decision making at the first place, the diagnosis level. Actually released for Android, iOS version coming soon. Visit us at www.epatientindex.com. Before you agree to that treatment, check your e-patient index score. You see here your score, and you see here your score factors. You have not read your paper medical record. Subcutaneous panniculitis-like is missing the required lab declinality, and subcutaneous panniculitis-like can be confused with panniculitis. You don't have any alternate opinion. More negative factors in your score. You have an opinion mismatch between your main opinion and your second opinion. Unspecified retinal detachment can be confused with unspecified retinoschisis. You are scheduled for a procedure. Apply the logic of the informed consent to make sure you really agree. Read more in advices. What is the future of healthcare? The informed patient, the involved patient, the empowered patient, the e-patient. Goodbye unchecked medical paternalism. Welcome, participatory medicine, health 2.0. Let's see this video. What is the future of healthcare? I'm feeling lucky search. 5 predictions why 2018 will be the future of healthcare. Patients will design if the most complex healthcare technology at least by inspiration. 2018 may be the year of the informed patient, the involved patient. The future of healthcare is, in 2018, the informed patient, the involved patient. The third leading cause of death in U.S. medical errors. 250,000 people in the United States die every year from medical errors. One other reports claim the numbers to be as high as more than 400,000. This is a problem. PPACA found the solution: Patient Protection and Affordable Care Act. The patient protection was introduced in Section 3506 of the ACA to facilitate shared decision making. Shared decision aids at the treatment level, but more important, at the diagnosis level. Y Combinator's request for a startup also knows the solution. They report that the healthcare is badly broken in the United States. We need diagnostics, we need preventive healthcare, we need data. At the left, you see an RFS. Diagnostics, make sure your diagnosis is not wrong. Data, give more data to patients and doctors too. Preventive healthcare, first thing first. Like this RFS, let's focus first on the diagnosis, and if we really need the treatment, then we will then focus on the treatment. Solution number 1, the need for data. Next video from my nonprofit, the Degenerative Retinoschisis Society, www.retinoschisis.org, might save your life or at least your vision. It illustrates the need of data for informed decision making. In the next video, 3 experts misdiagnose 1 patient. It shows the need of data from doctors too. Please watch carefully this video, as this is the only presentation that introducing a product immediately puts you in position to save your life with a very, very important raising awareness, brought to you by my nonprofit, the Degenerative Retinoschisis Society. Let me ask you one question. Have you ever heard about this disease, degenerative retinoschisis? I'm pretty sure 99% of you will answer it no. Now take a look. Degenerative retinoschisis easily confused with retinal detachment. If you are diagnosed with a retinal detachment, and you don't have symptoms, you are 20/20 perfect vision, make sure your doctor is not misdiagnosing you. Let's read from Wikipedia. This type of retinoschisis is very common with a prevalence of up to 7%, and you didn't know about it. It can easily be confused with retinal detachment by the non-expert observer, and in difficult cases, read, and in difficult cases, even the expert, even the expert might have difficulty differentiating the two. Such differentiation is important since retinal detachment almost always requires treatment, while retinoschisis never. I have saved your vision with this raising awareness because I'm pretty sure you didn't know this. Unfortunately, one still sees cases of uncomplicated retinoschisis treated by surgery. Don't let anybody convert you into this, unfortunately. Such treatments are not only ineffective but unnecessary risk complications. This is important. There is always vision loss in the region of the schisis. Don't let anybody convince you that you have a detachment because you have vision loss in the periphery. Let's keep reading. The misdiagnosis of retinoschisis. Some examples. Senile retinoschisis is a well-recognized clinical entity since 1983. Let me stop it there. So, it's a well-recognized clinical entity since 1933, and you didn't know about it, and it's important for you to know about it. So I feel like telling people in New York, hey, there's a Statue of Liberty there, because this is a very well-known entity. Let's continue with the video. In the majority of cases, no symptom. Confusion of the retinoschisis with retinal detachment does occur and results in unnecessary laser or surgical intervention. Case number one, a 26-year-old male was referred to the retina service after three retina specialists, three, not one, not two, three, had diagnosed bilateral retinal detachment and recommended urgent surgery. He was asymptomatic in 2020. He was diagnosed as having retinoschisis, saved by the bell by the fourth opinion. Do you know what a differential diagnosis is? As a patient, you need to know what a differential diagnosis is. In medicine, a differential diagnosis is the distinguishing of a particular disease or condition from others that present similar clinical features. It's like what diseases your diagnoses are easily confused with. Differential diagnostic procedures are used by physicians to diagnose the specific disease and eliminate others that look alike. A differential diagnostic procedure is a method to identify the presence of a disease entity where multiple alternatives are possible. So in Medscape page, you see that for retinal detachment, the differential diagnosis DDX includes senile retinoschisis. So how come three specialists did not even mention and apply the differential diagnosis procedure? Patients always ask the doctor if they apply the differential diagnosis procedure. Patient index, the Waze GPS of medical records. Patient index will give you data. Notice that three doctors did not provide the differential diagnosis. In the previous example, patient index will do that for you. When you have retinoschisis, it's normal to have vision loss in the periphery. So a feature in patient index like Waze GPS will warn you that the finger contest, like the one to the right, is not enough to convince you that you have a retinal detachment. Patient index will give you the common symptoms of a disease for you to have your symptoms ratio. Patient index will warn you if some required lab that guarantee a diagnosis are missing. Some patient index data will come from patients. Like I said, like Waze GPS giving data to other users. Patients sharing their notes and medical info with other patients. A patient who had one procedure will share about the risks to another, will share about the postoperative instruction, and will share the alternative. And data from patients will provide the success rate of surgery and if it's easy or hard. So a patient index will be like Omnidroid learning from doctor's mistake and warning other patients. If the clonality test is missing, like I found in the web from a Berlin spider example, if the clonality test is missing for an SPTCL diagnosis, a patient index will warn you. If asymptomatic retinal detachment can be confused with retinoschisis, a patient index will warn you. If you are agreeing to chemotherapy without a second opinion, a patient index will warn you. So let's see patient index in action saving that 26-year-old man. Let's see a patient index in action saving the young man who needed 4 specialists in the previous example to skip a surgery he didn't need in both eyes. Let's see patient index in action saving that young man. Let's open a case. You are 20/20 with perfect vision and you go to an optometrist who wants to see your retina. They ask you, okay, may I dilate your pupil? You say yes. And then the retina sees something in your retina and then he wants you to see a specialist. That's when you start a new case in your patient index. We organize the information in the patient index by cases by organ. You open a case, you select the organ, and you put the description for the case that you're opening. We're organizing your information, not dumping it into, we're organizing it into an open case. You see no main doctor because you haven't seen any doctor yet. And then you go for the doctor visit with the optometrist and you register that visit in e-patient index. You specify you don't have any symptoms, you're 20/20 perfect vision. The optometrist doesn't provide any diagnosis because he's not a specialist. No medicine, no lab test, and no procedure schedule. Those are the events you do during a visit. The only thing he does is he refers you to another specialist to see your retina. Here you put the comment in your visit master that you're 20/20 perfect vision and you have an optometrist referring you for a retina check because of something he saw. You are referred to another hospital with the retina specialist for retina evaluation. So you see that visit there and you see the pending visit for the referral and you see that the main doctor is now the optometrist for now because it's the only doctor you have seen. The optometrist did not give this patient any diagnosis or any disease, any comment, only that I want you to have your retina checked by a specialist. And you see the score factor 635 fair. And let's see the warnings that this patient is getting before going to the retina specialist, just with the referral. Take a look. Retina check, negative factors. You have not read your medical records for the optometrist visit. Nothing about us without us includes also going to the optometrist because they write note. When they refer you to a specialist, there's something they might have written in that note that you need to know. Nothing about us without us. Look at another warning. You don't have any alternate opinion. And you see, you have a referral for retina check. Do not let anybody check your retina if they don't mention degenerative retinoschisis. Look at another warning before going to the specialist. Watch out. Degenerative retinoschisis can be easily confused with retinal detachment, even by 3 or more experts. Good advice before going to the specialist. Now, you don't fear that the specialist is going to confuse your retinoschisis with detachment because you have valuable info to ask him questions. This is the power of e-patient index, giving you information.